Interdental brushes. Interdental brushes come in a variety of sizes. It is important to note the colour, as this indicates the size of the brush you will need to use. Not every gap in the mouth will need the same size, so finding the right size is important. You want to use the largest brush you can to fill the space. The brush should fit snugly in between the teeth and shouldn't have to be forced through. The bristles of the brush should fill the gap nicely. A back and forth motion should be used, using the bristles to clear away plaque and bacteria from under the gum line and in the gap. The brush should gently be dragged against the side of the tooth and cupped against the side, pushed back and forth for 2 seconds. Then place the brush more directly against the other side of the tooth and drag against the tooth for another 2 seconds. Let's see that action again in the mouth. Notice how the brush fits snugly in between the teeth, filling the entire gap. Interdental brushes should be used from the front and back of the teeth. The same motion should be applied, pushing the brush through and dragging against the sides of the teeth to eliminate plaque and bacteria. The brushes usually come with a cap, which can be used as an extension to allow extra reach within the mouth. Let's see a small brush in a big gap and see how ineffective it is. Using a small brush in a large gap is like using the wrong tool for the job. As the brush cannot fill the space, it cannot clean away all the plaque and bacteria surrounding the teeth and under the gum line. Using a too large brush in a gap can also be harmful to the mouth. If the brush won't go through easily, it may indicate that you have a too large a brush for the gap. Using too large a brush in a small gap can be damaging and irritating for the surrounding gums. If you have a too large a brush for the gap, it will soon become clear that the brush will not be able to go through easily. Interdental brushes should be rinsed and washed after every use, and ideally not kept for longer than 1 week. If the interdental brushes become overused or bent, they will not be able to clean successfully in between the teeth. Discard bent or broken brushes and select a new brush for continual cleaning. Over time, some gaps may need larger brushes. This is because inflammation has reduced and the gap is slightly larger. This is a positive sign that oral health is improving. If you see bleeding when using interdental brushes, this indicates a plaque and bacterial buildup and should ease with continual use. If you have any further questions about using interdental brushes, please don't hesitate to contact your dental hygiene therapist or dentist for more advice.